So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease-free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
All right. Hello, everybody. Welcome to our presentation today, brought to you by Assuaged Foundation. And today we are going to be talking about a lot of things, just about navigating the mental health crisis and navigating challenges and promoting well-being. That's basically what today is going to be all about. We're going to be talking about lead poisoning. All right. Today we do have a group of student speakers who are joining us. And my name is Dumisani Maraire Jr. I am the founding artist of Love Heals the World. And today we will have student speakers joining us. We have Sana Mian, we have Dr. Mahima Patil, and we have Allison, Bifone, and Lilly Valladares-Macias. I hope I'm rolling my R's and pronouncing everyone's names correctly. Please forgive me if I got any of them wrong. Of course, we also have some featured board members with us today. There's myself, Dumisani Maraire Jr. Like I said, I'm with Love Heals the World, and I'm also media director for Assuaged. And we have Cynthia, who's going to be behind the scenes. She's our vice president, of course, and she's going to be helping us with some technical stuff in the background, along with Crystal Rylowicz as well, director of practicums as well, who's going to be joining us as well. Welcome, everybody. We also have Vila, who, so these are some of our slide contributors. So we have Vivila, who also assisted with some of the contributions for the slides. We have Chiao-Yin Joy Chang, and we have Svitlana Mathany. We have Favour Edehomon, and Tammi Vu. And of course, the one and only Karizza Cordero as well is joining us as well today. And sorry, was one of our slide contributors for this presentation today. We're so grateful for everybody who contributed and everyone who's here with us today. That's a little picture of me with one of my favorite rappers and I guess the US Olympics mascot this year, Mr. Snoop Dogg. Yeah, we're just here to support the student team here at Assuaged. Love Heals the World is basically a new online arts and humanities club dedicated to spreading the divine healing power of love through music, blogs, and fashion. We call our members healers because they're passionate about spreading the healing power of love. And yeah, that gives you a bit of an idea of what Love Heals the World is all about. Now, of course, we couldn't make this happen without support from Restream. So we want to say thank you, Restream, for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. So basically, our message of public health and wellness now reaches those who need it the most, all thanks to Restream. So thank you very much, Restream. We do appreciate it. Now, we do have an agenda today. Our agenda, we're going to have an introduction. So our introduction is going to have a definition. So we're going to talk about the prevalence and significance, the scope of mental health issues, factors contributing to mental health. So that's going to be in our introduction. The second one, we have warning signs and symptoms. All right, sorry, I just want to make sure, we're going to edit this out, but I just want to make sure I'm reading from the right thing here. Yes, I am. Okay. All right, second one, we have warning signs and symptoms. So we have common behavioral and emotional indicators, the types of mental health crisis, unique challenges faced by specific populations. And third, we have impact interventions and stigma, emergency services and crisis prevention strategies, policy and advocacy. And then we're going to talk about, we're going to have a conclusion and student discussion, which is just going to be a recap of the key points, encouraging collective action and discussion questions. All right. So for the introduction, a mental health crisis is basically a period of intense emotional or psychological distress that exceeds an individual's coping capabilities. It often involves severe symptoms of mental illness, such as severe anxiety, panic attacks, suicidal thoughts or behaviors, psychosis, or acute depression.
Hey,
Mental health, yeah,
Jimmy,
I think that's someone else reading this, right?
Yasana's taking over from here, and then
That's
you
what I
do.
thought. Okay. And
And
even the intro actually, I thought this was about um, lead poisoning, but
you make me laugh so much. No, it's okay. We understand, brother.
I'm gonna
It's.
have to re-record that introduction
Do
later
you want to just redo it, or what do you want
because
to do?
wasn't it supposed to be about lead poisoning? I thought that's what the PowerPoint that I was sent was saying.
Cynthia, doesn't
No.
it say
That's why I'm a little confused now. But it's okay. I mean, I think I can always re-record the intro. You know, everyone doesn't have to wait around for that.
Okay, so we can just pick it up from here and let
Yeah, so
Sana.
we can just pick it up from the introduction.
Okay, Sana, take it away, my
sure.
dear. Or if you
Thank
want to introduce Sana, Dumni, you can do that too.
All right, 1 second, because I can't read what's at the bottom here. So 1 second, let me just go ahead and introduce her. All right, so for our introduction, we have Sana, who's going to assist us and let us know what a mental health crisis is all about.
Thank you so much. Hello, everyone. We are here to talk about mental health crisis and the way to tackle them. For introduction, mental health crisis is a period of intense emotional and psychological distress that exceeds an individual coping abilities. It often involves severe symptoms of mental illness, such as severe anxiety, panic attacks, suicidal thoughts or behavior, psychosis, or acute depression. Mental health crises may result from various factors such as a trauma, stress, substance abuse, or underlying mental health disorders. Prevalence and its significance. Mental health crises are prevalent worldwide and can affect individuals of all ages, genders, and background. The significance of mental health crisis lies in their potential to lead to severe consequences, such as self-harm, suicide attempts, substance abuse, or violence towards others. Addressing mental health crisis promptly and effectively is crucial to preventing harm, providing appropriate intervention, and supporting individual in their recovery journey. The scope of mental health issue. Let's go over the statistics on global burden of mental health disorders. it is quite prevalent. 1 in every 8 people in the world live with a mental health disorder. COVID-19 greatly impacted and increased the mental health crisis globally. 28% more people experience anxiety and depression as a result of COVID-19 pandemic in 2020 compared to 2019. Of course, there is a treatment gap in low and middle income countries. 85% of people with mental health disorder do not receive treatment. And there are some gender disparities. Women are more likely than men to experience common mental health disorders such as depression and anxiety. Men are more likely to die because of suicide. The common contributing conditions contributing to the mental health crisis are PTSD, bipolar disorder, depression, schizophrenia, eating disorders, and anxiety. Now, let's talk about the factors that contribute to mental health crisis. There are social determinants of health, there are biological factors, and there are environmental stress. Among the social determinants of health, poverty, limited access to resources and opportunities leads to increase and contribute to mental health issues. Discrimination, experiences of discrimination based on race, gender, sexual orientation, and other factors can negatively impact the individual and increase impact their mental well-being. Biological factors in genetics. If there's a family history of mental health disorder, that can increase the risk of developing similar condition um, in the in the coming generations. Brain chemistry, any imbalance in neurotransmitter can affect the regulation and contribute to mental health disorders. Among the environmental stresses, a traumatic event such as abuse, violence, disaster can have a long lasting impact on the mental health. And chronic stress, in terms of stress from work, relationships, or financial difficulties, strain mental health resources and resilience.
All right. Next, we're going to have our student speaker, who's going to be Lilly, who's going to be telling us a little bit about the warning signs and symptoms.
There are often warning signs and symptoms that can help you recognize when there is mental health deterioration, both in yourself and in others. So some of recognizing some of these signs of mental health deterioration stem from being attentive to different changes in behavior, emotions, and thought patterns. Signs include withdrawal from social interactions, changes in sleep or eating patterns, difficulty concentrating, increased irritability, and hopelessness. And common behavioral and emotional indicators include changes in appetite or sleep, increased substance use, risky behaviors, social withdrawal, and decreased performance. Also including persistent sadness, anxiety, mood swings, irritability, anger outbursts, feelings of guilt or worthlessness, and thoughts of self-harm. And so some of the types of mental health crises are: 1, suicidal ideation, which are thoughts of self-harm or suicide, feelings of hopelessness or despair. 2, panic attacks, which are sudden onset of intense fear or discomfort, and rapid heartbeat and difficulty breathing. And there's also psychosis, which is a loss of contact with reality, hallucinations, delusions, and disorganized thinking. And so there's for the overview of crises, it's important to be able to differentiate between the different urgent situations. And so in situations where immediate intervention is needed, suicidal ideation with plan or intent, severe panic attacks with the inability to function, and psychosis with risk of harm to self or others. And so seek urgent support. So with suicidal ideation without an immediate plan, panic attacks that cause distress but are manageable, and psychosis without immediate safety concerns. And so some of the impact on individuals and communities include, sorry. So there's a severe impact on individuals and communities. Untreated mental health disorders can lead to the following, according to the National Alliance on Mental Health Illness. They can diminish quality of life, preventable disabilities, cause substance abuse, unemployment, homelessness, incarceration, and suicide. And some of the economic implications of mental health are that each year, untreated mental health disorders incur a cost exceeding $100 billion in the United States alone, according to the National Alliance on Mental Illness. And so there's also a heavy stigma surrounding mental health. And so the role of stigma in preventing help-seeking behavior, according to Ahad et al., the stigma significantly inhibits help-seeking behavior academically. People may experience shame, fear, judgment, and view seeking help as a weakness and worry about confidentiality when they're seeking help. These obstacles can substantially impede access to necessary services and support. And so efforts to reduce stigma and promote open conversations are very important. Stewart emphasizes reducing stigma and fostering open dialogue to address mental health issues. Education initiatives and positive media representation are vital in shaping public attitudes. Open discussion, school-based mental health education, and healthcare provider training are all essential for creating a supportive environment conducive to seeking help for mental health issues and disorders.
All right, thank you very much, Lily. Next up, we have Allison, who is going to go ahead and tell us a little bit about mental health crisis interventions.
Thank you. So some response strategies for individuals in crisis include when someone displays signs of distress or trouble, it is crucial to reach out for help. In crises, it's recommended to contact the mental health hotline. There are local numbers available online, and if someone's behavior poses a safety risk for them, you or others, call 911 for urgent assistance. It's of great importance of trained professionals in crisis intervention because they offer reassurance by instilling a feeling of safety, assures companionship, and furnishes vital resources such as listening services, hotline contacts, mental health referrals, safety planning, and environmental safety measures. Some emergency services and their importance. Emergency services swiftly respond to mental health crises, prioritizing urgent cases and employing de-escalation techniques. They ensure safety by stabilizing environments and referring individuals to appropriate ongoing support. Coordination with specialists ensures follow-up care bolstered by emergency responders and specialized training. Their prompt assistance is vital in safeguarding those in distress. For example, Lifeline Chat and Text connects individuals to crisis counselors for emotional support. Calling 911 for immediate help, or contacting the local mental health department or hotline for assistance. Some additional crisis prevention strategies. Early detection and delivery of assistance can prevent or mitigate the effects of mental health crises. We should enhance mental health care plans to prevent problems and intervene early, especially for young people. Community-based programs, peer-led drop-in centers, and community-based suicide prevention outreach teams are effective in averting attempted suicide and suicide. Mental health and special populations. So we have a few different populations here that have unique challenges that they have to face and tailored approaches to help address their diverse needs. So in youth, they are vulnerable to academic pressure, bullying, and social media related stress. And it is recommended to have school-based mental health programs and peer support group and counseling services. In elderly, they face isolation, loss of loved ones, and physical health concerns that can impact mental well-being. So for them, there can be home-based mental health services and community outreach programs and support groups. In the LGBTQ plus community, they face discrimination, social stigma, and rejection from family or community. So it's important to have culturally competent mental health services and LGBTQ plus affirming therapy and support networks.
Thank you very, very much, Allison. And next up, we have Dr. Mahima Patil, who's going to go ahead and let us know a little bit about mental health and special populations.
Impact
Oh,
of
sorry.
technology.
Sorry, I messed that up. Let me just take it again. Next up, we're going to have Dr. Mahima Patil, who's going to tell us about the impact of technology on mental health.
Impact of technology on mental health. So there are positive and negative aspects of technology. So the positive impact would be access to mental health resource and support apps, teletherapy and online counseling services, health tracking tools for self-care and monitoring. The negative aspects would be increased screen time leads to sedentary behavior and sleep disturbances, cyberbullying and online harassment affecting mental health being, FOMO, which is fear of missing out, and comparison leading to anxiety and depression. The role of social media in mental health crisis is very crucial. So the positive influences are connectivity and support networks for individuals with shared experience, awareness campaigns, and mental health education. The negative influences are social comparison leads to feeling of inadequacy and low self-esteem, and cyberbullying and online harassment can lead to mental health issues. Now, recognizing the workplace mental health is super important. So, how do we recognize and address these issues? Be attentive to changes in behavior, mood, and performance. Encourage open communication and provide support resources. Offer mental health training for managers and employees. Promoting a mentally healthy work environment. Foster a culture of acceptance and support. Encourage work life balance and stress management. Provide access to mental health resources and support services. The policies and advocacy. The need for mental health policy reform. Addressing the importance of updating mental health policies to meet current needs and challenges. Emphasizing policy reform's role in improving access to care and reducing stigma. Second is the advocacy efforts to reduce barriers to mental health care. First is highlighting ongoing advocacy initiatives aimed at removing barriers to mental health care, such as stigma and lack of access. Second is showcasing efforts to increase funding, expand services, and promote mental health education and awareness. The collaborative approaches. First is improving mental health involves more than just mental health professionals. It requires collaboration among diverse experts to enhance program effectiveness. Because of the complexity of the mental health care, a single industry or profession cannot sufficiently address the demands of patients on its own. Collaboration across healthcare, community organizations, and government is critical for developing a comprehensive mental health support network for the following reasons. First, the holistic approach. Collaboration among professionals can result in positive experiences for patients and professionals, thereby improving care delivery. Second is the improved outcome. Integrating mental health care into healthcare management can improve patients' results.
Fantastic. Thank you very much. And Dr. Patil, we appreciate that. Now we have next up our board member, Crystal, who's going to go ahead and talk to us a little bit about access to mental health care.
Our access to mental health care includes barriers to accessing mental health services, such as identifying common barriers like stigma, cost, limited availability, and lack of awareness, and emphasizing how these barriers hinder individuals from seeking necessary mental health care. Strategies to improve accessibility and affordability include highlighting solutions like increased funding, expanded telehealth, integrated primary care, and affordability initiatives, and stress the importance of community outreach, education, and destigmatization for improved awareness and help seeking behavior. Our conclusion is a recap of our key points and includes, in summary, collective action is vital to tackling the mental health crisis. Recognizing signs, assessing resources, and fostering support are critical. Encouraging empathy for those in crisis is essential. Let us unite in our commitment to prioritize mental health, for only through collective action can we create a world where every individual receives the compassion, support, and resources needed to overcome the challenges of mental health. At this time, we would like to open the floor and have all of our participants turn your cameras on for our student discussions. Question number 1. How can we recognize signs of mental health crisis in ourselves or others? We recognize the signs of a mental health crisis by including extreme changes in behavior or mood, withdrawal from social activities, difficulty functioning in daily tasks, increased substance abuse, talking about harming oneself or others, extreme anxiety or panic attacks, hallucinations or delusions. We also recognize these signs by paying attention to changes in behavior or mood that seem unusual or concerning and being open to communication about mental health. Question number 2. What sources are available in our community for individuals experiencing a mental health crisis? Community resources for mental health crises often include hotlines such as suicide prevention lines, crisis intervention teams, mobile crisis units, emergency psychiatric services at hospitals, community mental health centers, support groups, and online counseling services. Additionally, some communities have specific resources tailored to certain demographics or cultural groups. And now we open the floor to our students.
Thank you very much, Crystal. Yeah, we have a couple questions there. Just to recap, how we can recognize signs of mental health crisis in ourselves and others. And the second question there is, what resources are available in our community for individuals experiencing a mental health crisis? Mental health is obviously a very important topic in the world right now. I would say specifically after the pandemic, it seems like it's kind of exploded, both in awareness and both in just the behavior of, I don't know, maybe it's starting to calm down a little bit now. What do you guys think? I think since the pandemic, the mental health crisis has kind of gotten, it's just exploded. And I feel like people went through so much, all the lockdowns, all of that. Um, and it's just been something that it's taken a while for people to kind of recover. I don't know. What are your opinions on that?
I totally agree with you, and I just feel that people have become more aggressive, and there's less tolerance. I don't know if it's just my personal observation, but in my surrounding, the way people drive and even at work, uh, and because with COVID, I know COVID brought a lot of awareness as well, because people started recognizing how much social interaction was important and how much they missed that out during COVID. But after the COVID, returning back to the normal situations like driving to the to workplace, or expected to show up, or just looking at the trends of unemployment or the people who are claiming that they can't work when they actually can, that's just the negative aspect that has been brought out because of COVID, and people are unable to cope, maybe because it lasted for such a long time and it really affected their personality and mental health in a way that some it's really difficult to cope and work in normal circumstances. And yeah, but COVID has really impacted every each one of us in one way or the other. Some people have come out of it, some are still struggling, and some are not there yet.
Absolutely. Are there any signs or symptoms that you guys have noticed that maybe we can recognize in ourselves or in others that may indicate that someone's having like a mental health crisis?
So, some of the signs that I've seen uh, just in the workplace or when I'm going about my day to day, it's definitely the social withdrawal, is what I've noticed. People tend to keep more to themselves, or they won't participate if there's a team activity occurring. Another one is expressing general feelings of hopelessness or being very anxious. Those are some things that I've noticed.
Those, absolutely. I think those are all some very great signs and symptoms over there. If anyone else has any more, feel free. And also, if there are any resources that you may know of that people can use, if they're going through these mental health crises. So yeah, any signs and symptoms and any resources that you can think of.
I just would like to say that we really must know who we are surrounding ourselves with. And for example, if you know that a person is really talkative and they're willing to help, and then all of a sudden 2 or 3 days go by and they're really, really super quiet and they're putting on pretend smiles, trying to cope, that there's definitely something wrong. And I will say that as long as I've been here with the students at Assuaged, it's no big surprise that I have mental health problems. I think that everybody has a mental health issue. It just really depends on how deep it is. And like Sana said, since COVID happened, some people are still using that as an excuse not to have to go to work or go to school. And the longer I can play this out, that's causing more harm. If you do not deal with your mental health, it's just going to get worse. This is not something that's just turned up overnight because COVID hit. There's been mental health illness in the world for a very long time. And it really depends on how well you take care of yourself. And if you don't know what resources to go locate in the community, please reach out to someone, whether it be your local health department, your doctor, a friend, your boss at work, because somebody will be able to help point you in the right direction. If your mental health spirals that far out of control, you are not sure whether you're going to harm yourself or someone else, and it can take a long time to recover from that. So those are my thoughts on the mental health crisis for now. Thank you.
Absolutely. Thank you, Crystal. Anybody else have any other contribution?
Yeah, I actually wanted to say I have a different note on this COVID. I just feel because of COVID, like Crystal said, mental illness has always been there, but I think it just came to the surface because of COVID, because there were a few people who didn't believe in mental illness. They thought it was just something people made up or it was just an excuse. But those people who actually went through, and also the other ones who didn't believe and had to go through it, started recognizing it. And to be honest, in past 4 years, there has been more talk on mental health and overall issues and how to deal with depression. So that's one aspect. And also there has been research actually with kids who were born during the pandemic. They have been diagnosed with broad spectrum autism, and this is only because of lack of interaction with other people. because at the end of the day, we're all social beings, and these kids lacked that basic interaction when they were born. So at age of 3 or 4, most of them are getting diagnosed with autism, and I personally know 2 of our family friends whose kids got diagnosed recently. So mental health is something that we cannot take lightly. And yeah, COVID did have a positive and a negative impact on mental health, is all I can say.
Wow, yeah, that's very interesting to know about with the impact for a lot of the children who were born during the pandemic. Um, I think some of the signs that I would say, from what I'm hearing from everybody, is like probably one of the biggest signs is like when people go silent. That's probably how people try to deal with their mental health most of the time, is silence. And of course, usually silence is probably the worst thing you can do when you're going through a mental health crisis. Probably better to just speak out, because usually if you speak out, number one, you realize that you're not alone and you're not the only person going through whatever you're going through. And even if you are like going through something completely unique and completely different that nobody else is going through, there are usually some sort of resources out there that can help you. But people can't really read minds, so you got to be able to express it some way somehow. And I'll be on. I'm usually quiet when I'm going through some mental health crisis. I have mental health episodes from time to time, and usually I try to keep quiet. But I definitely know that it's not the right approach, and that's what I would suggest to people: is best to speak out, best to reach out, and just let people know. I'm not having a good day today. Sometimes you're allowed to have bad days. It happens. Um, so moving on with some of the questions here. Um, Question 3 is, how can we effectively support someone in a mental health crisis without exacerbating the situation? Effective support involves active listening, showing empathy and understanding, remaining calm and avoiding judgment, encouraging the individual to seek professional help if needed, and offer to assist them in accessing resources. Avoid trying to resolve their problems, but instead focus on providing emotional support and reassurance. And question number 4, we'll just cover that quickly. How does stigma surrounding mental health issues contribute to the challenges individuals face during a crisis? The stigma surrounding mental health can lead to feelings of shame, embarrassment, or fear of judgment, which may prevent individuals from seeking help or disclosing their struggles. This can exacerbate feelings of isolation and delay or hinder access to treatment and support services. Stigma can also perpetuate misconceptions and discrimination, further marginalizing individuals experiencing a mental health crisis. So just to recap, the 2 questions there are, how can we effectively support someone in a mental health crisis without exacerbating the situation? I love that word, exacerbating, nice and long and tongue twister. Um, and then number 4 is, how does stigma surrounding mental health issues contribute to the challenge that individuals face during the crisis? I'll go ahead and tackle number 4 quickly. I feel like the stigma surrounding mental health, the one, if we can say, good thing that kind of came out of this whole COVID thing, like someone else mentioned earlier, there were good things and bad things. And I would say probably one of the good things was, I feel like the stigma has kind of been, reduced, maybe not erased, but reduced. I feel like it's made it more acceptable to talk about it, and people are more open to it, and people are more understanding. What do you guys think? How can we support people, and how does the stigma around mental health issues contribute to the challenges that they face?
I think that it's really important to really meet people where they're at. And I think that goes to with the stigma, because a lot of people who have mental health issues and disorders, they might not be willing to confront that just yet. And so I think definitely meeting people where they're at and knowing that they might not know that they're necessarily dealing with something, and just seeing what help that they need, but also how willing they are to get help. And so being able to just be there and support them in the ways that you can. because sometimes too, when people have and exhibit different mental health issues, they often are also dealing with other issues as well. Like with the pandemic, yes, there is all those issues are coming to light that people have had previously, but also people are dealing on top of their own mental health issues, the issues of financial insecurity, losing their jobs, health risks, all that different stuff going on. So I feel like definitely meeting people where they're at definitely helps with not exasperating the situation. If someone's not necessarily willing to get help for certain issues that they're suffering with mental health wise, but they are willing to get a little help with something else, I think it's definitely assessing the different issues that are under and overlying with their situations too, and seeing what they're willing to get help with and what they're willing to accept.
Amazing. Yeah, I think that's important. Meeting people where they're at. I think that's very, very important because, if you try to, once again, people need to know that they're not alone, you know, and I think that's very important. Any other contributions?
I'll chime in. The one thing that I don't like about number 4 is the stigma, because one of the longest stigma going is if you have mental health problems, you have a disorder and a tag, you're automatically dangerous and people need to avoid you. And that tag goes along with schizophrenia quite a bit. And there's actually evidence out there that most schizophrenics are not violent. You should not be afraid of them. And for example, we did speak about autism, which falls under the mental health spectrum, but autistic people are not necessarily dangerous either. And so I think that we need to be more open to accepting that just because you have a mental health illness and a diagnosis just means that you think differently and you can behave differently, but we need to accept that people are different and mental health does not make you a bad person. And by supporting them, meeting them halfway, and just asking, what's wrong today? What is something that you would like to discuss with me? How can I help you today? Not force feed them all kinds of medication and take them to counseling places that they don't want to be at, because if they're not ready to confront that issue, they're not going to open up, they're not going to be honest, and you're not going to solve anything, and neither are they. So just having your listening ears on and being supportive would help a whole lot in this particular situation. So thank you for allowing me to share.
Absolutely. I think that's very important. The message that just because someone is having a mental health crisis doesn't mean they're like a bad person or anything, right? It's something that people go through, and yeah, obviously we wish that everyone was just perfect, but we're not. We're human beings. We all have bad days, once again, and people should know that it's okay to have bad days from time to time. So let's see. Any other contributions for how we can effectively support someone in a mental health crisis, and also just tackling the stigma around mental health as well?
Uh,
Yeah, I would add to what Crystal said, that opening up a dialogue at your individual level, and of course trying to talk to them, just asking with simple questions. How are you doing today? Is how can I help? These are just the basic questions, but they mean a lot. They may mean a lot to someone who's having actually a bad day, and maybe affecting from a mental health issue. But of course, directing them to appropriate resources is one of the thing, and raising awareness, that there are helplines, there are individuals who can actually talk to them, professionals, mental health professionals, and there are helplines for them, where they can talk and discuss if someone does not want to do it openly, they can, reach out to right resources. And of course, telehealth medicine has progressed a lot since COVID-19, and that's in a good way, because some of these people are shy and they don't want to come out because of stigma and surrounding the mental health issues. So that's a good thing which COVID brought out. Not only people are recognizing that there are issues that need to be dealt, and they are understanding that there are proper channels where they can reach out without exclusively telling everyone that, hey, they are not feeling well.
Amazing. All right. Thank you. Let's see. I think we have one or two more left. If you want to touch on that, do you have any other contributions to it, or no? If not, we can just move on to the final phase. But I
Yeah,
want to give you an opportunity.
I actually wanted to talk about how I'm going to combine the third question and the fourth question.
Yeah.
So I just feel we did have a slide where we spoke about how we can improve mental health issues at workplace. So I just feel when you're allowed to take leave when you have fever, cold, or you met with an accident, whatever it is, the physical aspect. I just feel the workplace, the companies should be more open to someone taking leave because they're not in the right headspace, or they're not feeling, they're just not feeling well mentally. So I think that should also be something that we should incorporate in our work style, where people are allowed to take leave if they don't feel well mentally.
Absolutely. Absolutely. That's amazing. Yes. Let's see. Do we have any final contribution here? I have one more question after this of my own, but do you have any contribution on these, on number 3 and 4? Nope. All right. We're good. So, my my own question, which is not in the slide here, I've done a lot of work with some organizations that deal with mental health. For example, we just finished capturing a lot of content at the One Humanity. One Humanity's they have a big festival coming up that's going to be focused specifically on mental health. So it's a music festival, and they're doing it to help people find, escape, a way for them to not have to worry too much about, mental health. So it's kind of like a resource. And then there's also Work to Be Well, which is another organization that I've worked with in the past as well. So one question that I always loved asking when I was involved in these projects and other projects that were similar to that, which I think can help people, is, we all go through mental health issues from time to time. What do you guys like to do to help, when you're going through a mental health crisis, or to prevent a mental health crisis from creeping up? I'll speak for myself. I love music. I usually try to create music, or I listen to some music. Um, Usually creating music can help me. I'm sure none of you have heard any of my music, and that's because when I create my music, I always tell people it's just like a mental health thing, and it's just my way of escaping sometimes. So I don't really care who hears it, right? It's not like a commercial product for me. But it just helps me with that, and my brother still can't understand why I take that approach, and a lot of people can't understand it, but I'm just like, it's just my way of coping with stuff sometimes. Now, I know, of course, a lot of other people, they'll rely on maybe substances and get abused to substances or other things like that. So, what do you guys like to do to help, you know, to help deal with mental health crisis if you're going through one, or if you can feel one creeping up? Like, what are some things that you like to do?
So for me, when I'm especially stressed and I feel like it's going to start building up into a mental health crisis, I tend to bake a lot as my outlet. It originally started, I was watching the Great British Baking Show when I was in school, and then it just turned into me wanting to try to bake some of the things that they did on the show, and that just became a really fun thing for me to do. And I love being able to share the baked goods with my friends. And another thing I really like to do is I like to go on walks outside and reconnect with nature, and just being surrounded by that really helps to ground me in those moments.
Amazing. Baking, yummy, yummy. All right. And walks are always I think walks are a great way to kind of get away from it all, even if it's just for a little bit. Anybody else?
Yeah, I like to talk about it. I'm like, I need to talk to someone. I talk to my husband, I talk to my mom. I just need to talk to my loved one, what's bothering me, get their input, try to understand the situation. And also, I, like Allison said, I love gardening, so I just go out in the garden, but at the same time I'm just, trying to deal with it and understand and cope with it. But of course, and another thing that I do, I just go on I start deep cleaning my house and organizing stuff. So that's one thing I do. But I do that a lot, and it just relaxes me to put things in order.
Wow, yeah, I think cleaning is a good one. Definitely, definitely at least it keeps the house nice and neat, right, and tidy.
Yes.
So that's great. And I think clutter and a messy space can help add to a lot of the
Yes.
stress anyway. So
Yes, it
um,
does.
yeah, absolutely. All right. Anybody else with some suggestions of what you do or what other people can do?
I was going to add something. I know I've been in the background just running the show a little bit, but mental health is, it's a tough spot for everybody in the world, and I think finding those outlets, those way, Allison, you said baking, and Sana, you have your ways of coping, and so finding those mechanisms are very important. I love essential oils. I love listening to musical mantras. And there's so many different types out there, like water running, or, if you're into the Indian culture, I like listening to Lord Ganesha mantras, and, whatever kind of brings that harmony to your heart and your soul. And, I'd like to do raw juicing and really nurture yourself with nutrients. So, keeping in mind that mental health is also a part of what you're putting in your body and who you're surrounding yourself with. Like if you have toxic individuals in your life, it's okay to love them, but you don't have to surround yourself in that, because that will become your environment, so to speak. So I just wanted to add that.
Amazing, amazing. Meditation, anyone? Any meditators here? That's the one. That's the one that I hear most of the time whenever I ask people that question. When we're out, we usually hear a lot of people love to meditate, and I think that definitely helps. All right. Any other last contributions of what you'd like to do or what you'd suggest some people can do? If anyone has any, this
Yes.
is your chance.
I have a very good support system. I seek both counseling and I see a psychiatrist. I am on medication, so I have that support system. I am not too close with my family, but Assuaged has become my family, and I am very close with several people there that when I know that I just need to talk about something, I'm never let down. But I have 4 dogs, and my dogs know when something is wrong before I do. So if they just start excessively hanging on me, I know that they're sensing that something is wrong and I need to take that warning. So that's been very helpful for me. And a lot of times, I will journal, whether it makes any sense or not. Sometimes I just have overloading thoughts that I just write in a journal and I put it away because I don't want to relive what's in that journal. So if I know that it's something terrible going on and I start out talking about it and then just random thoughts appear, I put it away where nobody else can see it and I don't have to get it out until I'm going through one of those moments. So I try to provide myself with that self-care, but give the problems, not expecting my therapist and my psychiatrist or my Assuaged family to help me solve them, but definitely having that support system to say, hey, this is what I'm going through. Can you at least listen to me? And maybe can you help me figure out a plan of self-care? And that really does help. So that's what I try?
Absolutely. I think that's very important as well. I think it's very important to know that there's always professional help out there because sometimes, the circles that we're surrounded with and everything, sometimes there are people who can help you. Sometimes they just don't get it. And they usually mean well, but sometimes people just, they might not be the person who's qualified to help you with whatever you're going through. So I think it's definitely important. And that's one thing that I think, like I said, during the pandemic, that I think the stigma was kind of erased from that. Whereas before people would think something about someone going to go get professional help. Now everyone's like, I need professional help. Sign me up. Um, so, so I think that's very important. And I think that people should always know that that is a very, very important and useful option that's out there as well. It's better than keeping quiet and doing nothing about it, for sure. All right. Anything else? Anybody else have any other final contributions here? I think that was just about everyone, right? Okay. Um, well, I just want to thank you all for participating in this discussion today. Whatever it takes, whether it's friends, family, or professional help, there's always someone out there who can help assuage the situation. See what I did there? So I just want to thank everybody for tuning in. And of course, this presentation was brought to you by the Assuaged Foundation. We'd like to thank our student team and everybody who contributed to this presentation on the mental health crisis and navigating challenges and promoting well-being.